It's time for a Health Watch segment, and tonight we welcome back health correspondent Dr. Marisa Nimrod.
Do you buy Alive, giving you more minerals and vitamins than leading brands, distributed by H&J Enterprises Limited.
So good evening. Thank you, Desha. It's October, and it's Breast Cancer Awareness Month, and we're going to get straight to it. This is Breast Cancer 101. What are some of the things that you should know about breast cancer? So, we're going to actually look at what breast cancer is by definition. So, breast cancer by definition is the uncontrolled growth of cells. So if you actually look at the traffic light, cells, when they actually get injured, can do one of two things. They can actually repair, or they actually undergo programmed cell death, which means they're going to die, and it's referred to as apoptosis. But in this case, if the cell is injured and it continues to replicate without going through our checks and balances and stopping, then that leads to an accumulation of excess cells, which is why breast cancer becomes uncontrollable. So let's see exactly what is the spread of disease. So we can see that cancer is still the second leading cause of death globally. So looking at 9.7 million deaths in just 2022, and we're in 2024, and 20 million new cases or incidents, and this is according to the International Agency for Research on Cancer. If we look at the research, we can see 1 in 12 women and 1 in 9 men can and will die from cancer if they don't get the necessary screening that's involved. So let's look at the anatomy of the breast. It's important to know what we're looking at. So normal breast anatomy actually involves layers. So as we can actually see here, we're seeing the ribs, right, which is these bones here. We have the red muscle or striated muscle. That's the pectoralis that's referred to. So we have minor and major. And then if you can look at the breast itself, you can see the yellow areas are like the fatty areas in particular, which gives it its volume. And then breast cancer can affect two main structures. So we're looking at what we refer to is the number 4 area in particular. This is the ductal area, and this is where it most commonly affects. Or we can actually look at the purple area here, which is lobular, and those are normally the two locations when you look at the histology or pathology of where the breast can be involved. There may be others, but we'll discuss that next day. So we're looking at numbers again in terms of how much the presentations are. So we can see from this one, from the UK Cancer Research, that most women will find it in their upper outer quadrant. So you might actually be taking a shower and you just washing and lathering, and you might actually feel a lump. And that's where most women will find it, on the upper outer quadrant. However, it shows us again that we have different percentages. It can be in the inner, we can see lower, behind the nipple, and the nipple complex itself, or that little darkened area sometimes, depending, or the areola. And then some women may just find an isolated lump or a gland under the arm, which can present as an axillary node or a mass. So who does it affect? Is it just a female thing? Is it just women? So we know that it affects women, most common cancer in women, and it's second to lung cancer in terms of number of cancer deaths. And it's important to know that men can have breast cancer as well, depending on how much tissue you have. So we normally say it's like gynecomastia or man boobs. So if that glandular material is there, then they are also at risk of developing it. So let's just have a quick look at some of the risk factors and what makes it likely. So we can see family history of breast cancer. So if you have a family history, mom, aunt, someone else, we're looking at long-term exposure to a hormone called estrogen. So some of the persons, women, would be early onset of periods, for example, looking below 12 years, late onset of menopause, somewhere probably after 50, 52, women who have no children at all, called nulliparous, or probably have a late start to having children, obesity with that excess fat around the tummy area or on the whole, women who have hormone replacement therapy, probably for hot flashes, and then we have our two culprits, which is alcohol abuse and smoking. And for those of us who don't like to get up and exercise, inactivity or even a poor diet can put you at risk for developing breast cancer. So what do we want to do? So what is screening? Screening is really important. That is checking for something when there's no visible signs. So we always speak to the fact that early detection is what we're looking for. get there even when there's nothing showing up. Mammogram is still our gold standard, so we're looking at it's a low-dose X-ray, and we normally start after the age of 40. Sometimes your physicians will do a wellness check to see if there's anything that's different. And then you too need to take a role in your health just by examining and seeing if there's any abnormal changes. So we'll stop here for tonight. We'll see you for part 2. And thank you very much. And we want to thank Pink for breast cancer. Back to you, Daisha.
Well, thank you very much, Dr. Nimrod. Let's head to a break. We'll be right back.